We'd like to get started, and I'd like to introduce my friend and my colleague, Jean Daly.
Thank you. Chief Laurie extends his regrets for not being able to be here today. Chief Laurie extends his regrets for not being able to be here today. He's actually working with his guys in the fire department at a working fire. It's, I'm sure they've extinguished it now, but he's sorry he cannot be here. With us today we have Jen Monica, chairman of our Board of Selectmen. We also have our town manager, Dave Genero, who's going to speak to us about Article 1 of the special town meeting. And we have our guest speaker, pharmacist Ann VanHaaren. She works for CVS. She's the Clinical Engagement Director for the Health Systems Alliance. She's going to talk about the ABCs of medication management and medication adherence and tools that will help you with that. Thank you.
Okay, so we have a lot of information. Thank you so much, Jean. And we'll serve lunch. We want to thank OLV for being here today, as they always are on Fridays. They're so helpful for us, and we are so pleased that they're interested and that they are so civic-minded and caring, and that they come out every Friday to help us. So thank you for coming. We'll just take a moment to give thanks for one another, and let's keep in our hearts those friends of ours who may not be with us here today. Okay, we'll serve lunch. We'll serve those that are not able to get up, and then Lynn will let people know when they can line up for fish. Okay, thank you. Enjoy your meal. I'm very pleased to have our town manager, Dave Genero, here with us today. And many of you have seen the warrant article that's on your table. It's a very important article for us to increase parking next door. And we have an article that is going to allow the voters to consider the purchase of the lot next door. And Dave is here to talk to that. Thank you, Dave.
Sure thing. Thank you, Marcia. Okay, so as you all know, the second Tuesday of May is always the spring annual town meeting. We have a special town meeting that's starting right before the spring town meeting at 7 o'clock. One of the articles on there, as Marcia talked about, is the purchase of the land next to the building here. You may all recall that used to have the bank building on it that burned down a few years ago. After that burned, we contacted the owners of the property, and we did ask them if they were interested in selling the property at that point to the town, because we always thought once that building was gone that it would make sense that the senior center could expand its footprint over in that direction and have the ability to add additional parking, because this is a great lot, but on days like this when there's a big crowd here, and between that and the vans, it's a little hard to get in and out. So obviously, when this opportunity presented itself, we thought that it would make sense to bring it for the town. At that point, they weren't ready to sell. It took a little bit of a while before they had decided that they were going to. But they finally contacted us, and they said they were willing to do it. Now, at first, the price was a bit high. They wanted $200,000. At that point, looking at that, I spoke with the Board of Selectmen in executive session. We brought out an appraiser who appraised the property, and they came back with a market value appraisal of $65,000. That's a big difference from $200,000 down to $65,000. Now, what do you do when you hire an appraiser? The purpose of an appraiser is to give you leverage in order to make a negotiation happen. So with that in hand, we went back to the owner of the property and said, we are willing to work with you, but we need to get a better price. They had to think about it for a bit, and they finally came back at the price of $102,000. Now, the 102 is what they've been assessed for taxation for many, many years. We believe that at that price, while it's over the appraisal, it still makes sense because we have a longer view as to what this piece of property will be. It's a unique in what it is. It's a unique acquisition because of where it is with the senior center and what it'll allow for the parking here. So what's important to consider here is we're not borrowing for it. You're not going to see it on your tax bill. It's not going to be an extra charge. This is a transfer from the stabilization fund. So we are asking that town meeting transfer $102,000 out of stabilization in order for us to purchase this property on Tuesday night. So we think it's a great acquisition. We think it's great for the future of the town, especially with the fire station being built there, built right across the street, and the new parking lot that we're putting in between the fire station and town hall. This will really have this whole block really locked up as kind of a government center, if you will. So we are very, very hopeful that town meeting will support it. We think it'll be a great addition, and it'll be a great help for Marcia and the senior center, and we're really hoping it all works out. So if any of you folks have questions about that article or anything else about town meeting, I'm here. If you want to ask one or two, we've got kind of a full agenda, but if you have a couple of questions, that's fine, or you could just see me at the table afterward. Yes.
I haven't been to a town meeting since they held them down at the high school.
Yep.
How is the parking down there? I
Oh.
mean, obviously, there's gonna be a big crowd because of the overall.
Yes. There is,
I mean,
there.
where do you park if you can't get into the parking lot? You can't park on the highway.
Well, there's a lot of parking there. There is a lot of parking.
I mean, uptown here, at least you could park on Capron Street, Cross Street.
Yep.
And walk on flat ground. I mean, I know there's a hill down.
But overall, if you look at that parking lot down there, that parking lot is probably offers more parking up at the high school than we ever had at McCluskey. So I think you should have no problem parking at all. Just make sure you're there for 7.
Go early, right, that's a good idea.
Yeah. A little early would be nice, just because you do have to remember with a busy town meeting, the registration takes a little bit. So there'll be a line, especially if you come right at 7, there's likely to be a line of people, because everybody says, I'll get there for 7, and they all get there at 7, and you do have to register before you go into the auditorium. So if you are going, I would advise that you go a little bit early, just to make sure that you're not spending a lot of time in line. I guess that's it. Well, thank you very much, everybody. I'm going to turn it back to Marcia, but if you have any questions, I'll be sitting right over here, so feel free to let me know, and we hope to see you at town meeting.
Thank you so much. Thank you, Dave. I can't thank Dave enough for putting this article together and explaining the difference between the appraised value and the assessed value. So I know a lot of you had questions about that. I'm looking forward to town meeting, and I'm looking forward to this acquisition. It does require a 2/3 vote, though. So whenever there's a money article or a transfer, Dave, we have to do a 2/3 vote.
For an acquisition, yes.
For an acquisition.
For money, only if it's from stabilization. In this case, it's both. So it's definitely a 2/3 vote.
Yes. So we'll need your support at town meeting. Okay. For the benefit of the camera, I was talking with Cindy, Scott, and Dave about a position that's available at Pout Pond, and we just want to spread the word about that. It's a beach attendant, and you can contact Dave through the HR department. It's a great position for somebody that's looking for a summer job. It's an important position. Our Pout Pond has really grown, and a lot of people are attending there. And Pout Pond, it's never looked better. So I think it would be a great opportunity for a student or a young mom that might be interested in a summer job. So please contact the town manager's office if you are interested in that position. And now, without further ado, I'm very, very happy to introduce Ann VanHaaren. She is here from CVS, and she's going to talk to you about the ABCs of medication management. Welcome, Ann.
Thank you. Thank you, Marcia. All right. Let's just move my high-tech screen away. Thanks for your time today, everyone. As was mentioned, I am from CVS Health. I am a pharmacist by training, and in my past career, I did a lot of these talks at the senior centers, and very happy to be here today and have some time with you. We just have a very brief presentation, just a couple of slides, and we had placed around the tables a brochure and some sample boxes of the tool I'm going to talk about at the end of the presentation. So just so you know that those are there. So I have some questions for you about medications. True or false, the bathroom cabinet is a good place to keep medicine? Very knowledgeable group, correct, right. So medicine should never be exposed to direct sunlight, excesses of temperature that you might get in the bathroom, and also the humidity and moisture that we get in there. But who can give a suggestion of where a good place then to keep medicine might be? Refrigerator, if it needs to be refrigerated, yes. So great idea. You should be reading the package and make sure that there are directions that it should be stored in the refrigerator. Where else? Anybody have a suggestion of where they keep their medicines? That's right. Okay, yeah, we heard some kitchen cabinet suggestions. That's a good suggestion, as long as it's not near the stove or any heating elements or anything, and not in direct sunlight. So in the kitchen cabinet is usually a pretty regular temperature, and that's a great place to keep your meds. All right. So here's the next question. How many people do not take their medication the way their doctor prescribed them, the way the doctor asked? We have one here who's volunteering his own experience. But we have some multiple choice here. Do you think it's 37%, 50%, or 25%? We'll do a show of hands. How many think it's 37% A? Got a couple. How about 50% B? Good majority. All right, anybody think it's only 25%? Just one person. Again, you guys have heard this talk before. You are correct. It's about 50% of people today do not take their medications the way they were prescribed by the doctor. They sometimes take too many, or perhaps they might even take a lot less than they're supposed to, or not take them at the right time of day. So that can be a real problem. And the first step in really improving your health and being able to take better care of yourself is to take the medications exactly as they were prescribed as often as possible. That's the only way the medicine can help you. We actually have studies done now where people who are taking it 50% of the time get almost no benefit from the long-term outcomes we're looking for. So if you're taking medicine for your blood pressure and you only take it 50% of the time, it's probably not lowering your blood pressure like you're thinking it is. If you're taking it for your cholesterol, same thing. It's not going to work. When it really starts to work is at 80% of the time. So everyone forgets here and there, and everyone makes a little mistake, but you got to take it 80% of the time for it to work. Other ways that you can improve how you take your medications is being part of the story. So when you get prescribed, how many people bring a list of questions when they go to their doctor's office? Anybody? A couple people do that. I do that myself, because it's hard when you're in with the doctor and there's lots of things going on, but you should always be prepared and think about, when I'm there, what do I want to ask him about? And if you're taking medications, should absolutely be one of your questions, like, am I taking this the right way? Or, why am I taking this? Some people don't know, am I taking this for my blood pressure, or is it really for my cholesterol, like I'm saying? It's very good for you to be part of the story and understand where your medicines are, what they're for, and how often to take them. And then always remember that the pharmacist is also available as a healthcare provider to help you with those same questions around medications. So we can help you hopefully understand why you're taking it, when you should take it, and how often. And sometimes they're a little more accessible to you than the physician might be, or your nurse practitioner, right? Okay. The other thing that's really impactful about, and what we all think about now these days very often, is the cost of medications and how that impacts your health. So it's difficult, I know. Medicines can be very expensive. But if you don't take your medicines the right way, like we talked about the average people taking it only 50% of the time, it's money wasted because you're not getting the benefit from it. And actually, we see people who are taking their medicines less often, they actually spend more money on their health care in the long run, right? So you can imagine where some of those costs might go. Those folks end up going to the hospital more often. They end up going to their doctor's office more often. They might end up needing more care at home because they're unable to take their medicines the right way. Or they might have more time out of work, or actually get another prescription added because it doesn't look like it's working, when really it was because you weren't able to take it the right way. Okay? So things like skipping doses, or sometimes we stop taking the medicine if we feel better. Sometimes you stop taking the medicine. These are all reasons that people take it only 50% of the time. But remembering that if we take it as prescribed, you can actually help prevent future concerns with your health, like going to the hospital or to the emergency room, and it'll save you money in the long run. As part of the talk today, what I wanted to talk to you about is we really just went over how important it is to take medicines the way it was prescribed. But I also know as a pharmacist that it can be very challenging, and the more medicines you need to take, the harder it is to take them all the right way or as prescribed. So the tool that we're going to talk about today is our multi-dose packaging. CVS, there's lots of ways to help. Some of you, how many use a pill box now at home? They fill up a pill box, right. Those are great tools. It takes a long time sometimes to fill that box up, but it helps sort your medications by the time of day you're supposed to take them and keeps them all together, right? It helps you to be organized. And if you remember to go and open that little box, then you remember to take your medicines. So the box we have out on the table, CVS is now able to actually package your medicines that way. So puts all your oral medications, all your medicines that you take by mouth, into little individual packets that you can use, sorted just like your pill box. So there's one packet for the morning, one for the midday, and one for the evening. This box gets delivered actually to your home. That's another advantage. And hang on, I will show you a little picture of it. So it'll come it's a 30-day supply, and it comes mailed to your home, or you can have it sent to the local CVS if you prefer, and you could still pick it up there, because some folks like to go and see their pharmacist there. But if everyone had a chance to look at it, you can open these and pull these open. Each packet, I'll show you a better picture. Each packet is labeled with your name, with the time of day you're going to take the medicine, and with what medications are actually in that packet. If you're someone who has to take like 5, 6, 7, 8, 9, 10 medicines in the morning, you may have one, or you might have 2 or 3 packets that say morning on there. But everything will be put in a row in this blister pack. It also has the day and date of the week that labeled really clearly also on there, and it's clear on the back, so you can still see inside to see what's inside the package. So the next question might be how, if I want to do this, how can I get this package delivered? I want to tell you, it's not coming from your local CVS. So if you walk down and see Mike down at Uxbridge CVS down here, he cannot provide this for you, but he can give you some information about how you could get it as well. But we have a toll-free number there that a patient can call and sign themselves up, and you just ask the pharmacist there that you'd like to get multi-dose packaging. They're going to ask you questions about what medicines you're taking and who your doctors are. If you go to CVS, they can just see the prescriptions there and talk to you about how they're going to package them in this package. What it's nice about it is it's very hands-on with the pharmacist that way. The pharmacist, this pharmacy is actually in Virginia, so it's sort of a mail order. So you would get a call from that pharmacy in Virginia if you want to sign up each month. They're going to call you and say, how are you doing with your medicines? Has anything changed with your medications? And how can I help you more? And then you agree and you say, okay, if everything's going well and nothing's new, then they'll send you the box for the next month. No, that's a great question. So who is this best for? It's for anyone who's taking more than 5 or 6 what we call chronic medications, medicines that you take every day or every week. Anybody who's taking that number of medicines, this is a great product for, because it helps. We've seen that's who helps. It helps those people the most. You could certainly package them if there's only 2 medicines, but it's not really worth the extra effort. So how many people get confused with all the medicine bottles sitting on their counter and think that this might be a good idea for them? Anybody? Yeah? Couple folks? All right. That's another great question. It does not cost anything more than what you would pay at your local CVS. So everyone has a different insurance plan, right? With your Medicare Part D, typically they'll have little differences. But if you can fill at CVS, you should be paying the same thing. There's no additional charge because they package it this way, and there's no additional charge for them delivering it by FedEx to your home or to the store. What is also really helpful about this is it ends up having all your medicines filled at the same time. So I think some of you may experience, in the past I've seen my patients have, that they go to the pharmacy on this week and then they have to go again next Thursday and then they go again the following Monday because all of their medicines are due at a different time. This helps avoid that, where they're all filled at the same time. And it can make it easier then for you to take your medications. Are there any other questions from anyone? About this or anything about CVS I can help you with?
My neighbor here, she was just saying, if you have prescriptions filled at different times, your insurance company won't pay if you use it within a certain length of time.
Right. So if you've already filling your prescriptions on those days, and it's a 30-day supply, the insurance company can sometimes limit you. So when you're working with the pharmacy to get that first box prepared, they have a computer program, and they'll ask you those questions like, what date did you last get it filled? Oh, that was a 60-day supply. You can have that filled on this day. And then they find the best day that you'll be able to fill everything together. So it can take a little while to get that first box sent out. You're not going to get it the next day unless everything just happens to be due right away. But that's a great question. So when we sync up your medicines, it takes a little while because you got to use up what you have and do it the most cost-effective way for you. Any other questions?
Do you have to wait when you sign up if it's time for your refill, or does it's probably just like if you just got your prescription right away, then by the time the next month is coming?
Yes, Gail, that's a great idea. So if you're interested, and even if you just got your prescriptions filled, the sooner you call the pharmacy or call that 844 number. It's on the back of the brochures as well. The sooner the better, because they won't send you the box until you tell them it's okay. And it may take some time to get all the prescriptions together, as well as have everything scheduled and have you use up what you have left at home. So.
Yeah, if the prescription does run out, would the pharmacy call the doctor, whoever it was, or do you have to figure out if something, I gotta call somebody?
No, that's a great question. Yeah, great question. So the gentleman asked, if you ran out of refills, will the pharmacy still call the doctor and get those refills, or do you have to keep track? And just like any pharmacy, the pharmacist should take care of that for you. And they'll prompt the doctor once you get your prescriptions going, they'll call the doctor when you need refills and let you know.
Seems like a no-brainer.
How do you pay for your medicine? There's a copay for each one, so how do you pay that?
Right, great question again. So they will set up, when that first call, the pharmacist spends some time with you and they'll work out with you how you'd like to pay for them. Some patients prefer to just pay each month and send a check. Other people put their credit card or their health savings account card and they give it to the pharmacy and it gets charged to that. But again, the pharmacy is going to call you every month before they would do that and before they would send the box to you. So remember I talked a little bit about keeping you as part of the story and engaged in how you're getting your medicines. This is going to keep you working with the pharmacist. It wouldn't just happen without your permission or talking to you first. So great. I mean, if you like the idea and you want to call the pharmacy, please do. If you want to talk to your doctor about it a little bit and ask him and then have him send the prescriptions first, that's another way to do it. I'm leaving some brochures and my business card with the folks here at the Senior Center. Happy to answer any of your questions if I can in between time. I did talk a little bit about it, but I went down and met with Mike at CVS in town. If you use a different CVS that's not in Uxbridge, they may not even know about this when you go there because it's relatively new for CVS, and they have not gotten out and educated all of the pharmacists in all the stores. We have 9,000 pharmacies in the country, okay? And we're just newly licensed to do this in Massachusetts. So not every pharmacy knows. If you show them the brochure or if you talk to them about, what we said and they're confused, feel free to call my number if they can't help you, okay? Because it is new to them. We are working on educating them now, but I did want to warn you about that. Had a couple of folks go into their local store to ask more questions, and they were like, I don't know what you're talking about. Okay, so just wanted to let you know. Yes? So on the back, that's a great question as well. Where do they send the prescriptions? It's called CVS Multi-Dose Pharmacy, and it's in Ashland, Virginia. So on the back of the brochure is the fax number as well as some information they might use. If your doctor uses an electronic health record, they have a way to look it up using some of those numbers, but they can find it in there. So they can fax it, they can electronically send it like they do now, or they can call the pharmacy and call them in. And same way they would prescribe it to your local CVS. Same way. Yeah. It's just a different CVS, that's all. Okay, great. Well, thanks everyone so much for your time, and I hope you enjoyed your lunch, and good luck with the vote for Tuesday. Thanks.